Good morning, everyone. Welcome to the 8th annual AAAS Communicating Science Seminar. We're so excited that you are all starting your AAAS annual meeting with us today. My name is Emily Therese Cloyd. I'm the director of AAAS's Center for Public Engagement with Science and Technology. I'm joined today by a few of my colleagues who will be around all day in case you have questions about the seminar or the breakout sessions this afternoon, or about any other public engagement activities at the meeting. Alana Kimbrell, Mary Catherine Longshore, Jemima. Is Jemima here? Not yet? Okay. Kristen Lewis and Liz Crocker and Jemima Philippe should be here soon. So look for them if you have questions. I'm delighted that you're all here today, and I hope you're looking forward to the discussions of science communication and public engagement. This year is the second time that in addition to the morning panels, we have breakout sessions in the afternoon that allow you to dive more deeply into a number of topics. Those breakouts will start at 2:30, and there will be a 2-hour break in between the morning session and the breakouts in the afternoon so that you can go get lunch. There will be, at 1 o'clock, an Engaging Scientists and Engineering Policy Town Hall taking place here from 1 to 2, and that will talk about policy-related sessions at the meeting. So let's go ahead and get started. How many of you have been to a Communicating Science seminar at a previous meeting? Lots of repeats, great. How many of you are here for the first time? Oh, even more, great. So our panelists today are going to explore some of the promising and best practices and research related to science communication and public engagement. And when we talk about public engagement, what we're really talking about is intentional, meaningful interactions that provide opportunities for conversation and dialogue and mutual learning between scientists and a variety of public audiences. Speaking of audiences, one of the things that is really important in public engagement is knowing your audience. So let's find out a little bit more about all of you. How many of you are scientists or engineers? How many of you are doing some sort of science communication or public engagement already? Wonderful. How many of you are practitioners who are spending much of your time doing science communication and engagement or training scientists in communication and engagement? Yeah, great. And what about people like informal science educators, public information officers, science journalists? Some of those, great. All right, and then finally, how many of you are students? Okay. Faculty or program staff? Some of those. Anyone who is a department chair, dean, or other administrator? Some of those too, great. All right, well, I'm glad we have this broad mix of participants today. I encourage you to talk with one another during breaks and during lunch. We also want to let you know how to participate in the discussion after the panelists. So our panelists will do some presentations, but we've left lots of time for discussion. So what you'll do is after the panelists have finished, you can line up at the microphones to ask questions. We will also have index cards, so if you are in the room and want to jot down a question, not come to the mic, look for our staff, and they will be passing around index cards. And if you are online, you can tweet at Meet a Scientist using hashtag AAASMTG. So you can also ask your questions or join the discussion that way, and we will pass those up to the moderator. We would also appreciate your participation in a few very short surveys at the end of each session. So we'll post the links on the slides and after the breakouts as well. We want to look for ways that we can continue to make the seminar even better for next year, including the kinds of topics that you're interested in discussing and suggested changes in format. If you don't have sufficient phone service, you can also do this after the fact. We'll make sure that we send out an email with information about how to take those surveys. And we'll also do that on Twitter. So let's get started with our first panel, Engaging with the Media on Science and Society Topics. Our moderator for this session is Dr. Sarah Yo, Sarah is an assistant professor of communication at the University of Utah. Her research interests include science and risk communication, public opinion of STEM issues, and information seeking and processing. Her work has been published in journals such as Risk Analysis, Energy Policy, Journalism and Mass Communication Quarterly, and Materials Today. She's also written for popular science magazines like The Scientist and New Scientist. Originally from Malaysia, Sarah is trained as a bench and field scientist and holds an MS in oceanography from the University of Hawaii at Manoa. Her training in ecology and the life sciences has been invaluable to her research at the intersection of science, media, and politics. And with that, I'll turn it over to Sarah.
Thank you, Emily. Good morning. And thank you all for being here. I'm really excited about this panel, and it's an honor to serve as the moderator. We have a great group of panelists here today, and I'm looking forward to their talks and the discussion after. So, as Emily mentioned, the panel is called Engaging with the Media on Science and Society Topics. We have researchers and practitioners of science communication on this panel who are experts and ready to offer insights into what communication research has to say about what works about communicating and engaging with people. The practitioners on this panel are also ready to speak to examples of how media professionals and scientists can work together and can work together well. I myself am a researcher in the science of science communication, or what's becoming known as the science of science communication. And the flavor of communication research that is represented on stage, specifically by myself and Dr. Robin Nabby here, focuses on effects of media, right? What are the message effects on various audiences? And so we look at how these message features impact people's attitudes and their behaviors. What I'm sure will come as no surprise to you is that no single message feature or strategy has universal effects, right? In other words, there is no one ring to rule all the messages. So no single message feature, tactic, or strategy is going to make our science communication perfect. Because people are not homogeneous. Right? And as a result, our research focuses on conditional effects, effects that depend on something, often traits or values that certain groups of people hold. And because there is no single solution, right, this makes research in science communication and the intersection of research and practice even more important. And so, with that, I'd like to introduce our first speaker, Dr. Robin Nabby. Dr. Nabby is a professor of media effects and health communication at the University of California, Santa Barbara. Her research focuses on the interplay between emotion and cognition in understanding the influence of mediated messages, particularly those related to health decision-making. She has published over 80 articles and book chapters in this area, co-edited the Sage Handbook of Media Processes and Effects, and is currently working on an edited volume on the relationships between emotion and digital media use. Please help me welcome Dr. Nabby.
Good morning. This seemed to be a thing that everyone was doing, so I thought I would do it too. Thank you, Sarah, for the introduction. Thank you to all of you who are here joining us this morning. I want to begin by just noting that communication scholars have been studying the effects of news on audiences for decades. And overwhelmingly, the outcomes of interest have focused on things like learning or what's called agenda setting. That is, the agenda of the news gets transferred to the agenda of the public. So the more the news focuses on particular issues, the more the public thinks, oh, those are the important issues of the day that I should be concerned about. They've also focused on framing, which is how the issues are presented within news stories, and the way that these stories are framed can influence how audiences are thinking about these issues and what they might choose to do about them. Okay? And what all of these share is that they take a very cognitive orientation. It's a cognitive lens. But when we think about the news and norms of newsworthiness, that is, what are the features of stories that are more likely to get them covered by news organizations, there is a couple of elements that I'd like to sort of link together. One is that they're novel, they're new. That's obvious. It's in the word news, right? So it's something new and different and unusual. They're stories that are dramatic, right? So they draw us in and they get our attention and they orient us towards it. And they're relatable, right? So they're familiar, they're relevant to our lives. And what all three of these have in common is emotion. Right? right? They're all emotionally evocative. And what we know about the emotion and influence literature is that emotions influence the information that we seek out, right? So we're drawn towards information that's emotional, and we're more likely to select emotional stories over those that are not. When we feel emotions, we're looking at issues in different ways. So when we feel fear, we're more focused on the threat. And when we feel hope, for example, we're more focused on opportunity, okay, for the same issue. When we're feeling different emotions, it influences our decision-making processes and the behaviors that we might pursue, right? So when we're feeling fear, we act differently than when we feel hope. And when we feel emotions, strong emotions, that influences who we talk to and what information we share. The more emotional information is, the more we want to talk about it, the more likely it is that information is going to spread through social networks. Okay? So then the question for us becomes, how do emotions that are evoked by science news influence story selection, right? Issue perception, perceptions of credibility of news organizations, of scientists, of medical practitioners, and how does that influence what audiences want to do in terms of policy support and behavior? Right. Now, as interesting as these questions are, and as much research has been done on news, we know very, very little about the role of emotion and news. So that research has really only begun in about the last 15 years or so. So there's very little research generally, and even less on science and health news stories. So what I'd like to do is describe in brief two studies that focus on how the construction of news stories can influence emotions that in turn influence some important outcomes like I just described. The first study I want to discuss focuses on story framing. And I want to focus specifically on what's called equivalency framing. That is the same information, but presented through different lenses. And you see that cartoon kind of shows an example of the same information just presented through different lenses. In health communication, this equivalency framing is well captured by the concept of gain versus loss frames. So gain frames are focusing on what people have to gain or what benefits they'll get by performing a behavior. So if you wash your hands, you're going to stay healthy. Loss frames focus on what consequences you might suffer as a result of your behaviors or not performing certain behaviors. So if you don't wash your hands, you might get sick, you're going to lose work, you're going to feel terrible. Right? So same issue, just presented differently. Now, overwhelmingly, the research on gain and loss frames focuses on the direct effect of that framing on outcomes, like behavior, decision making. However, the research on gain-loss frames, the meta-analyses, the summary of that research basically has shown there doesn't really seem to be that much of a difference whether information is presented in terms of gain or loss directly. So in our research, we were looking at the role of emotion in this process. That is, when you present information in terms of gain, you're focusing on, hey, what could be good for you in the future? That's likely associated with hope. And hope leads to persistence in the face of adversity. When information is framed in terms of gain, you're focusing on threat. That's more likely to evoke fear, and people want to protect themselves and oftentimes avoid. So the question becomes, what is the role of emotion in this process? And in this study, we focused on climate change. So we developed news stories that were based on real information from actual news stories that focused on policies that were being considered in the state of California to mitigate the effects of climate change. And we presented the effects of those policies, or the anticipated effects. We presented that in terms of gain versus loss. And then we looked at the emotions and the subsequent attitudes towards these policies, as well as whether the participants in the study were willing to take advocacy measures. So we asked them whether they would sign petitions, and they actually signed petitions. We had letters that they could send to their congresspeople that they signed, and we sent for them. So they're actual behaviors. Okay? And sort of in brief, I'll just sort of give you the general results of the study. Consistent with past research, the gain and loss frames didn't have a direct effect on advocacy behavior. But we did see effects through these emotional arousals. So those who were exposed to these policies framed in terms of gain felt more hope. And that hope was associated with more supportive attitudes towards the policies and greater advocacy behavior supporting those policies. Those exposed to loss frames felt more fear. fear led to depressed attitudes towards these policies. Okay? And if we actually look at just sort of the summary of how much influence did we have over advocacy, there's 3 times the effect on advocacy behavior when hope was aroused versus fear. Okay? So that suggests that it's not just the framing, it's the emotions that people are feeling about what they're reading that has implications for how people act. Okay? Let me give you a second example, and this one focuses on the story construct of headlines. Right? When we see headlines, they're the initial frame to a story. Right? They're our entree into the story. And especially in the online media environment, we see lots of headlines, right? They're the links, and we go, do I want to read this one or this one or this one? Right? So we're scanning a lot of headlines. We're getting a lot of information, right, as a result of that scanning. But when we think about the emotionality of those headlines, especially in this era of the more clickbait style of how do I get you to click on my link, you make it more emotional. What is the impact of the perceptions of audiences, of scientists generally, of health generally, when we're scanning a lot of headlines on a lot of different topics? Right? So that was the question for the second study. And we culled headlines from the New York Times about health topics, and we selected headlines, some of which were neutral, but other headlines that reflected themes that underlie different emotions. So all participants in this study received 20 headlines. 10 of those were neutral, and one group got 10 headlines that were threat-based, which are presumed to evoke fear. The second group received headlines that were more positive, future-oriented, which we expect to evoke hope. The third group received 10 additional headlines that focused on what we're calling reversals, which is a new study that shows that what we thought we knew was actually wrong. And then the final condition was just the control group. They saw all neutral headlines. And we were interested in, after reading these 20 headlines on a bunch of different topics, what are the emotions people feel, and what is their sort of attribution of credibility to scientists, to news organizations, and what do they want to do in terms of their own health moving forward? And what we found, sort of like with study 1, that the condition they were in had no bearing on any of these outcomes. Okay? But the condition they were in did influence the emotions they felt, and the emotions had a lot of effects on these important outcomes. So for example, those in the positive future condition, okay, they felt more hope, significantly more than the other conditions. The more hope they felt, the more trust they had in news, the trust they had in scientists and medical practitioners, the more likely they thought there would be breakthroughs and cures for diseases like Alzheimer's, diabetes, heart disease in the next 10 years. And the more willing they were to say, hey, you know what, in the next 6 months, I'm going to do more to protect my health moving forward. Okay? Now, with the threat condition, it turns out that those headlines evoked fear, but also some hope, as it turns out. But we see some effects there as well, not as strong, but there's still an association with credibility of news organizations and with scientists, and a little bit of increase as well for intentions. What's particularly interesting is that for those reversal headlines, that group was more likely to feel anger, and that anger was associated with reduced perceptions of credibility of scientists and news organizations, and they also were less likely to say, yeah, I'm going to protect my health, I'm going to engage in preventative behaviors in the next 6 months. So just sort of summing this up to a couple of key takeaways, it is important what people know and what they learn from news, but it's also important to consider what people feel given what they know. And these emotional responses, as you've seen, can predict a number of critical outcomes. Okay? So these different emotional responses can be influenced by how scientists talk about issues to the public, to journalists, and how reporters convey that information to the public. So moving forward, it's important that we consider what we communicate, how we communicate, with that emotionality in mind. Thank you.
Thank you, Robin. So next up, we have Lisa Johnson. Lisa is a reporter and editor for CBC News in Vancouver. She specializes in science and environment stories ranging from octopus battles and solar eclipses to policy and pesticides. She also knows the frantic world of breaking news, covering wildfires, kidnappings, earthquakes, and a riot. Before she became a storyteller, she graduated from UBC with an honors degree in biology, which included watching fish mating dances. There's a theme here. She loves bridging the gap between science and society as a speaker and trainer. Please help me welcome Lisa Johnson.
Bear with me a second. Thanks for being here. So I want to focus my comments on the problem of false balance. And I want to do that because every time I talk to the public or to scientists about what I do, I can guarantee I'm going to get asked about this. And it's often around climate change, although sometimes it's around other topics. People want to know, why do reporters do this? Why do you put up in one story like decades of robust research with some opinion or a question or a doubt or it's natural cycling or whatever? Why do you do this? And really, when are you going to learn? And my answer you might not like. My answer is that on one hand, I would say that we have learned that this is definitely a bad thing and definitely is not something we should keep doing. And on the other hand, we keep doing it, and I would say we're going to keep doing it as long as reporters keep covering sort of novel topics to them that are complex and uncertain. And we need your help as experts in your field to help us do this better. So we definitely know this is a thing. We have, closer to the mic, we know this is, I'm a hand talker. We know this is a thing. We have a bunch of names for it even. False balance, false equivalency, both sides reporting, balance is bias, conflict among experts. And it matters because as a reporter, I want to be giving the audience the best concept, the most accurate concept of the best available evidence. And while that sometimes involves conflict and debate, if I'm constantly, or reporters are just constantly looking for the other side to the best available evidence, well, you can see how this is going to prolong debate and controversy on issues and lead to more disconnect between what the actual evidence says and what the public thinks about it. In a sweeping review of the BBC's science coverage a number of years ago, they called this out as an issue, saying it can produce an adversarial attitude to science which allows minority or even contrarian views an undue place. So, we know it's a problem. Then there's the reality of the fast-paced and sort of the world of news. And I can talk to you about that because I've been a news reporter for the public broadcaster in Canada for 15 years, and I do cover science and health and environment, nature stories, that sort of thing. But I also am in sort of that hectic, fast-paced environment, and this was a kidnapping, covered riots, another just sort of general daily news. And that is a really different world than science. But I've been in the world of science as well. This is me years and years and years ago with minnow traps, doing my field work for my undergrad biology degree, and continue to talk to scientists sort of about their work and how to talk about their work. These two worlds are very different. Newsrooms are hectic, fast-paced, and shrinking, importantly. There are fewer specialist reporters. Reporters are filing to more platforms in a day. They're often filing more stories in a day. And it's not uncommon for a reporter to get an assignment at 9 a.m. that maybe a topic that they don't have any particular background on and maybe even haven't heard of before that morning. And by 6 p.m., they're telling the country about it, okay? So even, journalists are professional quick learners. That is across the board, we're good at that. But even with that, you cannot, in that time, do an exhaustive literature search of the topic that you're covering. You can think a bit, you can read a bit, but then you're also needing to call people, you're needing to get those people to agree to interview with you, you're needing to perhaps drive to them in traffic, and then write and package your story for deadline. And that is a lot already in those hours. So, with that sort of scarce environment of time and expertise, we do rely on some things, some journalistic norms of kind of our mental checklist to figure out whether we're doing our jobs because it can never be perfect in that timeline. We're trying to be fair. We're trying not to take sides, give equal weight to both sides, be skeptical, consider who a story is impacting, and conflict makes a story. there's good reasons for every one of these, and I could defend every one of these, but it can also, this sort of norm of how journalists operate, can also interfere and work against our best interests if what we're trying to do is an accurate story. And this kind of framing that might arguably serve politics well, or say at court reporting, you can see how there's both sides. The defense says one thing, the prosecution says another in that particular framework, can maybe not work as well when you're talking about facts and evidence. Being skeptical, I think, is always important, but when you talk about a journalist with sort of limited understanding on their deadline of their, even if it's a good understanding, it will be limited, and a tendency towards skepticism, which is there for a good reason, much more vulnerable to someone saying to you, the science isn't settled, we don't know enough. That's a much more comfortable place to be than to try and what feels like going out on a limb and saying, we do know this, right? So against that, news organizations, and perhaps the BBC has been most transparent about it, have tried to re-examine this, the ways we work, and see if there's something we can do about this false balance problem. Looking at, okay, we're still going to try and be fair, but what does that mean? Equal weight, in the BBC's case, they've changed this in their guidelines, that equal weight is not what you're going for. You're going for due weight. And of course, you have to consider whose story impacts, but someone's opinion about it is not the same as evidence against it. I think these are good changes, but this due weight question is still a really big ask on deadline. Because if we can imagine every new topic that someone's encountering, you kind of have to figure out, is this something that is like an emerging scientific topic that there's still a lot of legitimate uncertainty and debate about, or are we heading towards scientific consensus? If you're a reporter or a news organization who's covered a particular topic a lot, you have a bit of a sense of what that framework is, right? Like maybe on scientific consensus, like, are vaccines effective? Yes, but will this year's flu vaccine be that effective? That might be somewhere a bit more in the middle, you know, for good reasons about how viruses evolve and things like that. But if you haven't covered it a lot, you know, your view is a lot more like this. You may be working really hard, trying really hard, and still not have a very great picture of the field that you're covering. And so what I implore the experts in the field to consider helping us do, reporters, when we come to you, is not just talking about sort of your one like dot in that matrix, but help us define where debates are in your field. And I want to give you an example of that so you know what I'm talking about. This is an example of a story I covered in Vancouver about lawns and about pesticides. So this is a lawn that's been dug up because of chafer beetles. So little grubs are in the lawn, and raccoons and crows come dig up the lawns. People get grumpy, and they want their lawn to be nice, and so they were using a chemical pesticide to kill the chafer beetles so that the animals wouldn't be trying to dig up the lawn. And that had been going on for years, and actually wasn't very controversial in sort of the, some people that liked it, some people didn't, but it wasn't that controversial. But then it became back in the news because of neonicotinoid pesticides, this really hotly debated class of chemicals all over the globe. You know, Canada, the US, the EU were all discussing whether we should be allowing these to continue to be used. And this is a neonic, this is imidacloprid. So I'm doing a news story, and it was not a learn your assignment at 9 and file by 6 case. I'd been working on it, had a lot of different interviews, had done a bunch of background reading, was going to file my story, and sat down to write that all-important paragraph about sort of what the thing is about this chemical and why we should care about this chemical, and realized, oh crap, I got both sides. I have quotes that are there. One of the most bee-toxic chemicals on the market. Extensive research has shown these products are not responsible for declines in honeybee colony health. Okay, possibly talking at cross purposes here. We weren't really talking about colony collapse in this story. But anyway, sitting there going, okay, I could do the quick thing, which is, these are really debated chemicals. Here's 2 quotes, file my story, be home by dinner. But that kind of felt like I would be saying to the public, you figure it out. These 2 people disagree. And that didn't feel good enough to me. So I was sitting there going, oh crap. I'm about to commit the sin of false balance, but I also cannot, before deadline, solve the problem of the most hotly debated class of chemicals, arguably, in the world at that time. What am I going to do? What am I going to do? What am I going to do? So call my husband and say I'm super not going to be home for dinner. Step one. There was not time, especially on the Pacific Coast, to do any more interviews that day. It was going on in the morning. So I decided, okay, and I got the voice of one of my science communication mentors, Nancy Barron, sort of in my ear. She's going to be at the conference later today. And she always tells scientists, lead with what you know. Okay, I can lead with what I know. What do I know here? Well, I know it is not debated that these chemicals kill bees because it's a broad spectrum insecticide and bees are insects, so okay, got that. Going back through all the regulatory documents, I was able to sort of sift out and sort down that the debate was. What we don't know, we do know that, what we don't know is whether, or what was being argued essentially, is whether the chemicals could be used at a concentration or at a time that the risk to bees was low or acceptable, because this class of pesticides is also useful for making human food and employment, et cetera. So there, at least, was settling down the debate. And the scientist I talked to had really helped with that. Even though he was, and not all scientists are comfortable with that, but was advocating for a position which was that in terms of green lawns in Vancouver, they should be banned, he was saying, the question is, can they be applied in certain ways they're not in contact with bees? And that is an area of some dispute. But it's not disputed whether they're toxic. And that really helped, I think, the public understand, okay, well, here's why some people think this, some people think that, and then being able to make decisions about what they think in terms of, green lawns in Vancouver. And so the story went out the next morning, and within, I think, about a month, but certainly that same season, Vancouver decided to ban these cosmetic pesticides for lawns in Vancouver, because that was not about human food production. It was about, not having raccoons dig up grass. So I think that was, not that it's my job or my intention to create a ban or whatever, but it is my job to help people understand where the debates are, where the evidence is, and I try to do that now, which is at least define where the debates is. So I implore scientists to help us get a bit better of a picture of what their field is and where the debates are, because remember, even a smart, hardworking journalist doing their best may only have a few of these data points. And even though that's very uncomfortable to talk about uncertainty, and there's a lot of issues with talking about uncertainty, do lead with what you know. And I would argue that even if you cannot solve the debate, and we really can never on Deadline journalists, defining the debate is important. Thank you.
Thank you, Lisa. Our third speaker is Dr. Jeffrey Duchin. He is the Health Officer and Chief of the Communicable Disease Epidemiology and Immunization Section for Public Health for Seattle and King County. He holds appointments as Professor of Medicine in the Division of Infectious Diseases and Adjunct Professor in the School of Public Health at the University of Washington. He serves on the Centers for Disease Control and Prevention's Board of Scientific Counselors at the Office of Infectious Diseases and their Advisory Committee on Immunization Practices and the Board of Directors for the Infectious Disease Society of America. Please help me welcome Dr. Duchin.
All right, well, thank you. Those two talks were amazing. They were like TED Talks, and I'm not a professional expert communicator, and that was reinforced when I registered, and I noticed my other speakers had speaker on their name tag, and mine says Thursday. So there's no doubt in anyone's mind that I am not a professional communicator. But I do have to communicate frequently, like many of you probably do, both with the public and with the press. And I wanted to share some examples of recent things. Right now I'm completely preoccupied with the novel coronavirus situation, and we'll end with that. But there were a couple of things that happened before novel coronavirus erupted that were bugging me this year about some coverage I was reading about the flu season. And many of you probably saw articles like this one from an excellent science report at the New York Times about Australia's flu season. The sky is falling. Australia had a horrible flu season. That's a big problem for the US. Get ready. We're going to get smeared. And there were multiple articles like this in multiple publications. And buried somewhere in the article was usually a statement like, it's too early to tell for sure, because sometimes Australia is predictive and sometimes it's not. and that was the expert at the Centers for Disease Control, Dan Jernigan. But the best move is get the vaccine now, and that's always the bottom line with flu season, regardless of what you think is coming. And I did a little research in response of all these fear-inducing articles, and we heard about fear, and went to the Australian Government Department of Health website where they characterized their flu season as low to moderate impact, with clinical severity being low. I'll lean over a little bit, but I may injure my back. Oh yeah, let me see. Maybe I can just hold this. All right, how's that? Better. All right, sorry. So, did you hear anything? Basically, there was a lot of bad stuff going on around the bad messages around the Australian flu season, and it turns out the government of Australia didn't agree. So they had much data on their website saying the flu season isn't so bad after all. Yet we persisted even throughout the flu season in urging Americans to get flu shots because of fears over a deadly flu strain. So again, invoking something that really wasn't happening elsewhere as a reason to do something here. What happened here was we saw a flu season that had absolutely nothing to do with the Australian flu season, a totally different strain, and that strain, you can see, is strange because it came early and it came before it usually does, and it impacts children more than adults. But the number of hospitalizations, which is on the top right, the red line, is really pretty average for what we see during flu seasons, and the total number of deaths is really lower so far than it has been in past seasons. The flu season's not over, things may change, but it was a little bit different than what was implied by the coverage. Then this happened, coronavirus, and I'll just share a couple of headlines from the New York Times. Coronavirus explodes in China, countries struggle to control its spread. Epidemic reaches bleak milestone exceeding SARS toll. China's omnivorous markets are in the eye of a lethal outbreak once again. Then our first case here, a couple of miles north of us in Snohomish County, and the travel restrictions that subsequently evolved in response as our federal government put our national preparedness plan into place. And of course, much of the news on social media, informal, has been tainted by a lot of bias, racism, and discrimination, in that people aren't understanding that your risk factor for this disease is having traveled to an outbreak area or having had direct contact with an actual case, and not the way you look or your ethnicity or your national origin. So we're seeing a lot of xenophobia and anti-China sentiment here locally. We did a recent press conference as well. And I wanted to also call out how our thinking and public messaging about this outbreak is evolving. And recently, increasingly, our federal experts have been discussing the fact that this is probably going to be a pandemic, and that what we're doing with respect to quarantine and isolation of cases and contact tracing is important because it's going to hopefully delay the onset and the severity possibly of this pandemic when it reaches the US. But these are all statements from Dr. Nancy Messonnier, who's been one of the lead CDC spokespersons. And these statements aren't really getting widely covered, which I think is a problem, because we really do want the American public to be prepared. So she said things like, all the pandemic planning that we've done for influenza is the foundation of our response to this virus. If community spread in the US is established, we'll implement broader measures to mitigate the impact of the virus on our communities. We have a window now, a window of opportunity to prepare. And as I said before, we're preparing as if this is a pandemic. So it's interesting to me that these messages haven't been picked up and widely shared by members of our national media. And here, this is, I think, another issue that relates to some of the great information that were shared by my first two co-panelists is a recent article from yesterday, and issues of framing and fear and hope are relevant here, as well as emotion. But this is a TV piece that then goes on print and says, King County health officials sent suspected coronaviruses to local motels. For years, the county has quietly transported people who need to be isolated to ensure public safety to motels that are vetted by public experts. And I go on to explain why we do that and why it's safer for the community to have people in a controlled location where they're monitored by public health professionals than wandering around at shopping malls, movie theaters, and other public locations. Yet the bottom line for this piece was that the emergency medical techs who work for the ambulance company that's carried out transports says it's ridiculous. So these illustrate, I think, some of the challenges that someone like me, who's not a communication professional, faces when trying to convey information to the public about their health risks and influence behaviors. So in closing, from my perspective, it's helpful to have a way to understand as a practitioner what is the science behind science communication. Clearly academia has a very rich understanding perhaps of this. At least it's an area of significant academic research, but it doesn't always make it down to the practitioner level. Is there an evidence base? Do we use it? What works and what doesn't work for specific audiences? And what is the goal of science communication? And we heard about some of this earlier, so these are perhaps redundant, but maybe we can explore them a little bit more. And in my business, communicating uncertainty is quite common. This novel coronavirus outbreak is a perfect example. And what is the context? How does the context of what we're actually talking about influence the type of message that we need? You know, an outbreak versus a chronic disease versus firearm deaths versus overdose epidemic versus anti-vaccine or vaccine hesitancy versus climate change, which is what I would personally be more comfortable and prefer to be spending my time on communicating those risks right now than a novel coronavirus. And then finally, how can science communicators and public health professionals collaborate to best serve the public? So with that, I'm going to hand the mic back to our moderator and look forward to hearing from you.
Thank you. Thank you so much. So if you'll just join me again in thanking all three of our speakers. We'll now open the floor for questions. There are a couple ways you can join in. There's a mic up here. We have folks wandering around with index cards, I believe. And via Twitter, if you tag @MeetAScientist and the AAAS hashtag. When you come up to ask a question, please state your name and affiliation before asking a brief question. I ask that you please refrain from making statements or using the mic as a platform for promotion, but we welcome any and all questions. Please.
Hi, my name is Danielle Lemon. I'm currently at the University of Colorado Boulder, defending my PhD in the spring. My question is for the false bias. What was your name again?
Hi.
Hi. So one of the sources of false bias not only comes when you have a mountain of evidence versus some opinion, but it also happens when a scientist makes a false appeal to authority. You know, like say a biologist, you know, one example was a Harvard postdoc that was also on the anti-vax train. And so skeptics really hold on to when a rogue scientist makes a false appeal to authority. But scientists also make great journalists, as on Utah Public Radio's Undisciplined. So how do we draw that line between scientists as a breadth of knowledge who can add to those discrepancies in knowledge when it comes to reporting and making the distinction between when a scientist making a false appeal to authority?
That's an interesting question. It definitely happens a lot. A recent example in Canada is that one of the founders of Greenpeace is a really prominent like climate skeptic now who was going to be paid $10,000 to speak at a sustainability conference, and he's someone who promotes that like more CO2 is better for the planet, it's plant food, it's going to be good for us. And so one of the things that's one of the reasons that that sort of false appeal to authority happens, I would say, is that journalists are often sort of like using really, like I said, we're quick learners, but we're also using a lot of shorthand with like, oh, that person's from such and such institution, like double check, yeah. I mean, I guess the most important thing is to actually ask the person, like, oh, what do you study? Like, what are you doing right now? That sort of thing. It is sort of on us to check, is this person really in a position to know the things that they're saying? But it is sort of I guess, a ripe area for exploitation if you're not checking that. I mean, it is our job to check things. I'm not saying we work quickly and therefore we're absolved of any of this, but it's important to be understanding where those vulnerabilities are.
Yeah, and I think to sort of add to what Lisa was saying, I also think it's important that scientists and journalists have relationships, right? Don't often sort of just cold call any scientist, and certainly that does happen, but quite often scientists and journalists do develop relationships where scientists can share things that they're working on, or journalists can approach them. And in some of my colleagues' research on journalism, they've actually found that Twitter is a really good place to start developing these types of relationships.
Yeah, hi, I'm Debbie Stein. I'm an independent consultant. I come more from the sort of policy practitioner world. So this is primarily on Robin's talk. So the thing that kind of I worried about as you were talking, even though I found your research very interesting, is I kind of worried about the ethical issues, because it seems to me that in some ways what you were saying is that sort of scientists and researchers and so forth should consider saying things in a certain way to evoke certain emotions to manipulate the public to take action. That's kind of like the message that I got. And that, I think, like from my policy world perspective, would not necessarily be viewed as a good thing. And so I'm wondering if you could sort of talk about the ethical issues of that and sort of being an independent, sort of policy neutral scientist versus an activist scientist, and that the ethical aspects of that.
That's a really interesting question, and I'm really glad that you brought it up, so thank you for that. And I didn't intend to suggest that it be, that framing be used as a way of manipulating audiences. I teach persuasion and have for 20 years, and one of the things I always leave my students with is, this is a tool, this is not. There are ethical implications of how we use this tool. My intent is more to demonstrate that the words that we use have powerful implications, and that we may think as scientists that when we convey certain information, it doesn't really matter, it's the facts or the facts. But in fact, the way that we present it can really shift the way people are thinking about it. So it's less a, hey, present it this way because then you're going to get this effect, as much as be aware that when you present information in a particular way, that you may shift the direction, right, of your audience's responses. That may, from a scientist's point of view, I always think of an example of how the doctors, for example, when they want to encourage patients to get a certain test, and they use fear to motivate. And for some people, that fear is actually going to discourage them from ever coming back. Right? And for those who frame it more positively, that can keep those who are more fear-inducing or more prone to fear to move forward. But for those who are not prone to fear, it can actually lead them to not come back. Right? So it's less that, oh, this is what we can do, it's going to work for everyone. It's recognizing that the words we use matter. Right? It matters in interpersonal communication, it matters in news communication and science communication. Does that address your question?
Well, yeah, I guess I would just say, like, if you were, say, teaching this in class, do you say, like, okay, A, good, B, bad?
Never.
Okay.
I never do that.
So, okay, so then I think as an audience member, I'm left
Yeah.
with, okay, this is interesting, but I guess I'm less sure what to do.
Yeah,
Right,
I
'cause I
think
don't
that
know what I should do.
I think you're
right?
exactly right, and I even said to the panel before, I was like, I can raise these issues, but I don't have an answer about what do we do about this. It's just an awareness that if there are those who, and whichever position you take, recognizing that how you put information together and the emotions associated with it, they have implications, right? And wherever that goes, should you be someone who is trying to mobilize an audience, well, then this is a strategy that can do it. Whether scientists are actively engaged in trying to do that, or whether they're just aware, hey, I don't want that to be done. I need to present this in two different ways, or I need to, maybe in the sort of fair and balanced kind of perspective, to just recognize that if you only focus on one perspective, that it is going to lead audiences generally in one particular direction. Thank you for that.
Just from a journalist perspective, we're really very uncomfortable with an idea of trying to advocate for a thing or whatever. But one thing that really stood out to me about what you said was the conditions where credibility is enhanced. And I think even if there'll be a million opinions in here about whether you're advocating for something, probably we all want to be trusted and credible. So that was, I thought, really, even if it varies on the message, I thought it was really interesting to hear that part.
Great, thank you. So just as a reminder, you can tweet your questions and they'll be transcribed and sent up here to me. So we'll field one from Alex Danker of the National Institute of Mental Health. And they ask, the speakers all spoke about the issues with greater societal impacts. How do you think the dynamics of communicating science changes when the issues being covered are more personally relevant to a reader? Readers have a tendency to not be as concerned when an issue seems far away, but what happens when that context shifts? So relevance of an issue.
What was the beginning part of
Yeah,
that?
so how do you think the dynamics of communicating science changes when the issue is more personally relevant to a reader versus not as relevant?
Well, I mean, I'll start if you all don't mind. When an issue is personally relevant, then it motivates people to pay attention, right? So one of the strategies often used in persuasion is how do you increase the sense that this is relevant? So newscasters might say, here's what's going on with the coronavirus. How does that impact us here on the Central Coast? We hear that in newscasts all the time, right? So the goal of that, right, is to make this issue seem more personally relevant so audiences will stay tuned, pay attention, and when things are more relevant, right, if we just devote more cognitive effort to processing those messages, we learn more, we carry more of it with us. We also have the potential to feel stronger emotions about it. We also have the potential to counter-argue it more, because if it's already relevant, then we're more likely to know a lot already if it's something that is a familiar topic. And as a result, we could be more biased in our processing. So again, it goes back to what you said at the beginning, that no one message feature, no one quality is going to have the universal impact on how people engage with messages.
Okay, here we are. Thank you, please.
Thank you. Hi, my name is Mauro Sidor. I'm a physician and professor of psychiatry at Columbia University of School of Medicine. I have two questions, and I'm also doing some research on medical practices and holistic care. My first question is for Dr. Nabi, and my second question is for everyone. You spoke about emotions and its impact on behaviors. Now, I've worked with, in my practice, I've worked with several attorneys, and they talk a lot about the use of fear having a greater impact on behavior as opposed to hope, as you talked about in your research. In fact, I remember there is a landmark study on, not actually a study, a case on that patient who went to the doctor and treatment was presented, but she declined and she actually died. And her family sued the physician because the physician had not told her family member what would have happened had she refused treatment. And you mentioned earlier how physicians, when we talk to patients, talking about what may happen if they refuse treatment, in general, it's been shown that telling them what happens they may lose tends to have some form of an impact behavior that's different. So I would like to see if you could comment on your research and what generally has been part of the traditional way of doing things in terms of fear versus hope.
That's a really interesting question, and there's actually very little research on doctor-patient interaction and fear and hope. So I just looked last year, and I could not find a study on the use of what were called fear appeals in a doctor-patient interaction. There's a lot of research on fear and persuasive messages and how that impacts audiences. And essentially what that work says is that the more fear arousal, the more compliant, right? Now, there can lead to reactance, it can lead to source denigration. There are a number of negative outcomes that can occur, but when you combine fear with efficacy, and efficacy can be associated with hope, then it tends to be more effective. So if I say, hey, here's a severe threat to which you're susceptible, you're gonna be scared, right? But if I say, but here's something that you can do, and if you do this, and you can do it, response and self-efficacy, then it's more likely that that person's gonna comply. It's not a perfect correlation. The correlation is about 0.2, but there is a greater chance that the person will be motivated to comply. But it is the combination of both the threatening information as well as the efficacy information that tends to be a better combination. But again, this is in persuasive messaging through the media as opposed to interpersonal dynamics. But really what it ends up being, and this is where my research is going, is a combination of fear and hope. So you present the threat, but also the hope as well. And that combination seems to have added benefit. So thank you for the question.
That's helpful.
Thank you.
Thank you.
So we have a question here from Tim Sieves. What responsibilities do scientists, science communicators, and journalists have in the initial reporting of novel science to reduce the negative impact of inevitable reversals? And you discussed reversals.
Well, I would just say to acknowledge the uncertainty that's inherent in the scientific process and more relevant in some areas than others. I think it's a problem when people have the assumption that science has definitive answers that never change, because science is, by definition, an iterative process. So saying, and you can see this really now, the Centers for Disease Control, HHS, our national spokespersons have been ingrained to say at this time, before everything, and all guidance is interim, and it's always based on what we know now. So I think having people understand a little bit more about how science works and understand the uncertainty, the context and magnitude for a given issue would be helpful.
The media's role in that, we need to listen to the caveats that the public health speakers or whoever else are saying and not cut those parts out of the soundbite because they make them, more boring or whatever. So that's on us. It is tricky though, because in the end you have to put something in a headline. And the headline is information that will get shared, and you'll get like angry Twitter reaction based on what's in the headline, people never cracking that story open, never reading it, never seeing any of the caveats. So that part's hard. But it is, I think the reversals, often what one study's saying this and this study's saying the opposite, they were like both within the range of error on each of those assumptions, but we cover it as though it's a flip-flop, and we have an ingrained bias towards surprising news, which makes reversal stories more likely.
I don't know how much more I have to add, but I think this is something that I've been struggling with, especially in light of our findings. I don't think our findings were surprising, right? But it does lead to the question of what do these headlines look like? I think you hit on it. Because that's what people are seeing, and they go, oh, this didn't work, or this was found to cause, these negative side effects, and you go, right, and the cynicism is right there. So if it's coming from the headlines, then how are those headlines constructed, and is there a way to represent some of that scientific uncertainty that we expect from the process in those headlines? I don't know how to do that. That's not my domain, but that is a possibility if that's where it's coming from.
just like to add one point. You know, the type of communication that I do as a public health professional is very different than what a journalist does and what an academic does. We're in the public health world looking at behavior change. We want people to adopt behaviors, use information to adopt behaviors that help them stay healthy. So we want people to change their behavior. We have a goal-oriented communication. It's not just take this information and, you know, it's interesting, think about it, and enlighten yourself. You know, we are really more focused on behavior change and have a more specific outcome in mind typically when we do our communications. For instance, if we were talking about immunizations, we want people to get vaccinated. You know, it's very nice to understand all the nuances of how different vaccines work and the proportion of time that someone doesn't take a response and become susceptible and so on. But the balance for us is really going to be weighted in crafting a message that will motivate someone to do the right thing to make themselves or keep themselves healthy.
Thank you. And I think just point is important, that I think sometimes as scientists we think we just want to inform publics, to let them make a decision, right, about the science. But it's really important to identify the underlying goal, like the true goal of what you hope to accomplish with that communication. And I think the surface level of saying, I just want you to be informed, to be able to make an informed decision, I think we need to reevaluate whether that is actually our goal.
Hi, so my name is Natalie Slavinsky. I'm a freelance science journalist here in Seattle. Hi, sorry. I'm a freelance journalist here in Seattle, and I was curious, this kind of ties into a lot of the previous questions. So I'm from here. My mom was a nurse. We're very you know, if there's a pro-science, we're pro-science. My husband's family is from rural Michigan. They're a little bit more prone to, you know, influence from those fear-based, anger-based, you know, they're prone to that distrust. And so, you know, keeping in mind that, you know, the ethics of pushing an agenda from a science perspective are, you know, you have to pay attention to that. I'm curious, Robin, in your research, if you found that there are societal factors like, you know, people in rural Michigan versus a liberal, you know, big city, for example, that really predict the impact of these, you know, fear-based versus hope-based messages and things like that.
That's a really interesting question. I haven't yet, and there isn't research that I'm aware of that has broken it down in that way.
There is or there's
there is not.
Okay.
Though, now in our work, we controlled on ideology, so we didn't look at that as a variable to break people out on. We were just like, okay, if we control on this, what happens? The research that I'm aware of with emotion typically focuses on more personality traits rather than reason. Sometimes demographics, sometimes older people versus younger, or men versus women, but typically it will focus on people who are more trait anxious or people who are more risk seeking, and again with some ideology, but not on location. So unless there's an association of ideology with so rural
sure there
versus
is.
urban, right? But that's where it would be captured. But I haven't done that research.
Okay.
Yeah, thank you.
Great. So we're going to take a question from the audience here. As scientists, how can we help staunch the misinformation prevalent on social media, especially around vaccines? And what is the conscientious journalist's role in this?
Do you want to talk a bit about the misinformation that you dealt with?
Well, there's plenty of misinformation about vaccines on social media, and it's coming from lots of different constituencies. There's not a homogeneous sort of vaccine hesitancy or anti-vaccine contingency. People have lots of reasons why they're hesitant and or anti. The anti, thankfully, are a relatively small group compared to those that just have questions and concerns and need good information to make good decisions. But my answer to your question is speak up. Don't be silent. Counter what you see. Provide fact-based, evidence-based information that will help people know the truth about vaccine safety. And the more voices we have out there counteracting or providing accurate information, I think the better served the public will be. But clearly, I think folks will respond to a variety of sources of information, providing consistent accurate evidence-based data. And then there's the emotion piece.
I guess from the media perspective, like a lot of where people are getting their information from, like it's not just in our information ecosystem now, what is coming from like a traditional news source is displayed sort of on a very even playing field with what comes from all sorts of other sources. And so it is a really challenging world in terms of misinformation, not just in health and science news, but all news, particularly on Facebook. Facebook is like what's gotten most attention. I mean, I think that it's really, I guess the answer is like do a good job as a journalist. But it is hard. I just want to like the sort of currents in society that you run up against was recently just socially at a ski hill. So I'm someone who covers science and vaccinated my kids, just as like putting that out there. But I'm at the ski hill with other parents, and I was saying, hey, if anyone knows any, I'm looking for some more stories to pitch. Like, always let me know about stories, right? Because all journalists want to know good stories. So when they pull me aside and they say to me, so why is the CBC like so pro-vaccine? It's like, oh, I haven't thought about that. So the Canadian Broadcasting Corporation, like the public broadcaster in Canada, and I was like, oh, I hadn't really thought of ourselves as so pro-vaccine. I would more hear like, why do you put on the anti-vax mom, or like from a couple of years ago. And I said, probably the wrong thing socially, which was, well, because that's where the evidence lies. And she's like, oh, well, what about all the other evidence that you guys don't pay any attention to? Like, we have our own evidence, right? Having your own evidence is like a facet of the information ecosystem we're in today, and that makes it really hard. I think, I'm not standing up here saying I have the answer about vaccine misinformation, but I do think that when experts don't just rely on authority, but also transparency, and are willing to like sit down, have conversations. There are vaccine injuries that get documented in certain ways, and like be really open about all that stuff for the people who want that kind of information. I think that helps. It's not going to be the thing that works for everyone.
I don't think I have to. No,
That's okay. Yeah. Hello. Thank you all so much for your talks. It was really thought-provoking, so thank you. My name is Rachel Knobloch. I'm a PhD candidate from the University of Maryland, Baltimore County. And I have a question specifically for Lisa, but anyone feel free to chip in. I was just curious, from an academic standpoint, when you all as a journalist are going through in your crunch time, if you will, trying to find credible sources and find, what to you speaks to expertise, what can us, the academic scientists, do in our own self-presentation to, to facilitate a little bit more trust from the journalistic perspective, or a little bit more understanding from the journalist perspective, or clarity in that process? So basically, what can we do to make your all's lives easier?
Well, that's a big question that there's whole science communication training workshops about. I guess relationships are useful. Being ready to answer, like to talk to a journalist. Sometimes it's not even always once you have a relationship with someone that you trust, like it's not always going to be the clip that's in the story or the quote that's in the story. It may be like, hey, I need to know a bit more about this. Like, is this off? It's trying to get that picture of what is the field and who else should I be talking to, who disagrees with you. Like, helping us understand the field better is good. There's so much to answer in that. But definitely, like, picking up the phone, be willing to start the conversation is a good place to begin.
Is there so you'd mentioned Twitter as one potential avenue for forging those relationships, but is there, like, any other, like, hot, I guess, good ways to do that, to establish those relationships in the first place?
Well, I mean, if you read people's stories and who does good coverage that you think is interesting and responsible, and when I mentioned Nancy in my talk, but like one tip she'll give scientists always is to, if someone calls you, like cold calls you out of the blue, is to say, absolutely, I want to talk to you, and I'll call you back in 5 minutes, and like Google that person and to have a sense of what they're up to. But anything else on relationships?
Thank you.
We have a question from Danielle, who is an If-Then ambassador. And specifically for Robin and Lisa, how do we avoid false balance without taking sides, because some things are supported by science, and how do we tell the truth about dire issues without taking sides?
I mean, I think, I was trying to give a hint on that in my talk. Like, reporting out, like, reporting and saying what we do know and what is clear, I think is helpful. And even when you get into what's often name calling in some of these debates, whether it's a climate denier, a climate skeptic, or anti-vaxxer, or whatever, I don't think those, I don't think, and I think it's also been demonstrated that those kind of terms are very taking sides and are not that helpful and not that informative either, versus sort of reporting out what the nuance and the context is for the arguments on either side, and then letting people read them.
Thank you.
Thanks so much for this. My name's Joseph Fridman. I work in a neuroscience lab in Boston, but I also communicate some science communications for the lab. And we do some work on science communication and audio and other things as well. My question's for Lisa, but it's also open to everyone. I'm really liked your talk because it helps scientists marshal empathy for journalists and understand the constraints that they're working within. And I'm trying to turn over the idea of asking scientists to step up, lead with what you know, and to define the debate. And I'm wondering what goes into somebody being able to define the debate. It definitely has to do with the type of story. Shorter stories, it's harder to define a whole field and kind of figure out where all the sides stand. It's harder for certain outlets that deal with different attention spans or different audiences, but it also has something to do with the credibility and the prestige of the person on the line. It'd be much harder for me to say, get on the phone and define a debate to a particular journalist than it would be for my advisor. And so I guess I'm wondering, what can we do to flag for journalists that we're gonna take a step back and we're gonna start doing some kind of epistemic landscaping as opposed to diving in directly to a particular debate? They're on they have time constraints, so it's often hard to have that like hour-long debate about the field, the history, why it got that way. So I'm wondering what folks of different identities could do to take that advice.
Yeah, I mean, I hear your point about when you're not like the sort of tenure professor who gets talked to in the media like every month about that topic. It's harder to be the one defining it. But nevertheless, if you're talking about your own research, you probably do know what it contradicts, right? That would be in your papers. You probably do know who agrees with you and who doesn't. And something contradicting each other doesn't need to be like, we are adversaries and we are conflict. It's, well, actually, this study is different than that, and the reason is like the people who were asked have different education levels or whatever it is. And just helping put your work in context, I think, is like a service to, you don't say like, tomorrow I'll email you a few more papers in my field, right? Because that's not gonna help. When journalists do ask you for a paper, many news reporters do not have access to journals. Like, it's something news organizations may not be able to, so if they ask you for a PDF, like, give it to them. But just saying like, well, once you read into the field, I'll talk to you. Like, no. But giving them some context on even your slice of it is helpful.
Thank you. So we have a question from Adam Clemens, who's a PhD candidate at Washington University in St. Louis. How should the public filter biases that are distributed? For example, when large conglomerates own news outlets and they push their agendas rather than public interest. And then also what do other outlets do to combat this? So I think this was specifically, that second part was specifically for Lisa, thinking about CBC.
Do you have something on that? I'll let you. I don't know how to answer that. Sorry, how does the public deal with the biases in news organizations?
When like one conglomerate owns a bunch of news outlets, right? And they maybe.
Yeah, so that's true, and that's increasing. That people local papers will all get bought up by. I can more say this part, which is local papers get bought up by a company, and then they cut a lot of staff in those local papers, and then they would reprint the same article across all the news sites, maybe even with the same banner. In terms of biases and whatever, they're there, they happen. Journalists are working hard against it. The public, I mean, you read what we are all in our own information bubbles these days, and that's, I think, a problem, but also true. And then other media organizations are just trying to do their best.
Thank you.
Hello, My name is Max, and I'm a student at Brown University who has a science background and is hoping to improve my science communication. So I appreciate hearing your research, Dr. Nabi, and I can relate to your experience as a journalist, Ms. Johnson. My question is this, and this is kind of at the core of this conference and this seminar, but when private for-profit organizations that have a lot of resources and competing interests are using some of that science communications research that you've been engaged in, Dr. Nabi, to spread misinformation and less than rigorous science, how do we as scientists, science communicators, and policymakers, how do we counter that?
Obviously, misinformation is a big issue these days, right? And unfortunately, and I think the first question kind of spoke to this, is that these techniques of framing, for example, and the emotions that are generated by them can be attached to information, whether it's accurate or not accurate. And it could be that, and I can't say this for sure, that those who are trying to spread information that maybe they believe is true, but is maybe the scientific community believes to be false, will do so in ways that are associated with fear, right? And that will spread, sometimes anger, and that will spread, right? And as I mentioned, the more emotional that information is, the more it's to spread. So it's difficult to counter emotionality with rationality, right? There's a little bit of research on this. It's not particularly conclusive. So if we're spreading information, or information spreads through fear, then to say, hold up, here's some statistics that say that's wrong, that's not really going to get very much attention. So I think you ask a really important question of how do we counter it. I mean, one possibility is, I don't want to be like, I'm not recommending this, but it's like you fight fire with fire, right? So you have the emotionality of one and countering it with emotionality. That hasn't been tested, right? But it is what gets attention. What I would say, backing up a step, is what's the frame, right? So when you frame an issue in a particular light, through the fear, for example, and that spreads, how do we sort of reclaim that narrative, right, and reframe? So it's not the best answer, but I think this is exactly what the field of communication is struggling with right now, is this onslaught of misinformation, and what are our strategies? So I would suspect in a couple of years there's going to be a better answer.
Luckily, I think there are other fields also struggling with this computer science, right? I think the problem of misinformation is out there, and it's not just on any one solution, right? So I think there are some technical solutions that are being explored. If we look at computer algorithms that maybe help identify false information. There's also some part that education has in this, right, in terms of media literacy and information literacy. But I think there's also the part that we have most control over here, and that is science communication, making our science communication better by using strategies that come from research, that we understand through research.
Hello, my name is Alyssa. I'm a graduate student at Columbia University. And I have a question for Elisa. I really liked your talk and how you explained your story about the insecticide and how you really dove deep into what the debate was and looked more into the intricacies of that instead of just saying, this is a good quote, this is a bad quote. But often I find articles don't do that, and I feel like you were driven by your own motives or a higher moral compass to do that for the public, whereas a lot of journalists maybe don't do that, maybe because of the time constraints and these things. But I was just wondering, for journalists, what training do you get to promote journalists to do that type of more deeper dive into debates? Or do you think that there could be regulations that don't hinder free speech, but to regulate reporters to do more of that type of reporting that really looks into the problems at a deeper level instead of just pulling bad or good quotes? And then another thing I'm wondering is, when you do look at research articles or these things, are you trained to look at the funding sources of those articles? Because one thing I'm interested in is nutrition research, and that gets bopped all over the place of today eggs are good, today eggs are bad. And if you look into the eggs are good stories, a lot of times those are funded by the Egg Society of America or whatever. So I was just wondering if you're trained on looking into those, or if there are any regulations to make reporters report what are the funding sources of these articles that they're presenting.
So there's a lot of questions in there,
Yeah,
and they're really
sorry.
good ones. Okay, so yeah, you're right that I was really motivated in that particular thing, and this is the world I enjoy like thinking and talking in. But all journalists are like, let's just assume that journalists are doing their best and trying their hardest, and smart people who want to do good. In terms of education about doing that, journalists I think are more educated than ever, but also working under greater time constraints than ever. They're not, often comes up in these discussions, like, should journalists covering science all have a science background? And I don't think so. I mean, my degree's from like a long time ago now, and science changes, and the most important thing is sort of like a curiosity and willingness to learn and appetite for that. So I'll just set aside that. It wasn't really part of your question, but it often is, and I don't think that's that important. Regulations of what to do, I wouldn't say regulate. Like most media organizations, and certainly mine does, have sort of journalistic, we call them journalistic standards and practices, so what is expected when you're covering a story. Following the money is something journalists love to do, but I would say in that realm that there can often be a switch flipped from like, oh, is this a gee whiz interesting science story, or is this a like hard-hitting, controversial, let's follow the money science story? And they can kind of like, our frames that we approach things with in the beginning can often color whether you're like, oh wow, this is the thing that was found, versus like, let's dive into all of that. Does that make any sense? That it can, so having some more awareness, I mean, it's definitely on the checklist of what a reporter should be asking and looking at when they're reading the journal article. And then there's things that get like, sort of framed as studies, they get sent out as press releases, and then you realize like the traffic study was paid for by like the GPS company, and it's, just a couple of those things. Was there an outstanding one there?
I am really interested in the reporting of funding sources for articles or literature that's reported about in the news. Is there anything you are taught or held to a standard to as journalists? Because I just really don't see that happening
Oh,
much.
I see. Like just like a blanket, it should be reported like you
Yeah,
report
like if you have a quote from an article and this is the person who was the lead author on that, but it doesn't say who funded that research or where it's coming from.
I think we would more be like tend to cover it if it's controversial, or like I would argue just use it to decide you're not going to cover that study or whatever. That something was funded by this foundation or that foundation, or like NSERC or whatever it was, that like doesn't get in the story because we assume that the public doesn't care. Yeah,
But
I mean maybe that's a bad assumption, but when it's sort of like a benign funding source, arguably, then we ignore it, and then if it's a toxic funding source, then we'd more query that some more. But yeah, it isn't covered that much.
Yeah. But I mean, do you think it should be?
I don't know.
Yeah.
If it's like this foundation, maybe. Yeah. Often it would be deciding like, are you even going to cover it? Like saying that this is a study that's completely compromised, like unless you're debunking the thing everyone put out in the news yesterday, like you maybe just don't cover it at all, you know?
Thank you. We have a question from Jose Martinez. So issues in society, such as infectious diseases, tend to open possible windows of political change, such as immigration. What responsibility as scientists do we hold to protect against misuse? And how do we go about that potentially sensitive communication, or successful communication of potentially sensitive science? This might be a Jeff question.
Okay, so I'm not sure if I'm understanding what sensitive science means, but there are some examples for in the current outbreak and past outbreaks where quarantine, for example, has been used, and the explanation for using quarantine, and right now there's an unprecedented super quarantine, it's actually more than quarantine, that's happening in China. The explanation has been to protect, some other interest from spread of this disease, where the people who are actually undergoing the restriction of movement are facing increasing risks themselves and lots of adverse consequences. So from my perspective, as a public health person who wants to use evidence-based practices, it's very important to understand the evidence base for use of a policy like quarantine. I'm just using this as one example of different types of policies that could happen with respect to infectious disease, and that there is not a strong evidence base for these large-scale types of quarantines, particularly for outbreaks that are going to last for a long time. And there's also a clear literature on the moral obligation of people who use these types of measures to make sure that they're meeting the needs of the people who are being quarantined and not imposing additional harms upon them. So I think that the bottom line is if there are political actions that are being taken in response to infectious diseases, which is what the question was about, or policies, that we have an obligation to make sure that the policymakers and the public are aware of the evidence base that supports or argues against the use of that strategy, and that we do whatever we can to make sure that those strategies are used in the most appropriate way possible.
Thank you.
Hi, I'm Jean Jaralskis. I'm the Executive Director of the McAuliffe Shepherd Discovery Center in Concord, New Hampshire. It's an Air and Space Museum. And so about 65% of the people that we're communicating science to and with are about this big. So I wonder, are there different strategies that you would use in communicating science with children? And do you think that that fear, hope, anger quotient is any different with young people that are just starting out as learners?
That's a really, really great question, and there's been very little research that looks at influence in anyone younger than 18, so there isn't that much, at least in this influence domain. But kids love stories. People love stories, right? And there's been a lot of attention recently to the role of narrative and storytelling in communicating information. I think it's particularly important now because there's so many sources that we can go to when you think about what do people want to read. Do they want to read a scientific paper, or do they want to hear a story? Right? And so whether it's little kids or grown-ups, we like stories. So I would say things that positive emotions, exciting, interesting, curiosity, that those emotions, they apply across generations, but for little kids especially, that's a really great way to try to get that information across. But I think the broader issue that we haven't really touched on is how to engage people across age groups in science, and to get them interested and get their attention. And we can use the emotional stuff, but storytelling it's part of who we are as human beings, right? We're storytelling culture. So taking that as a tool to present information can get people's attention, get them more engaged, and there's evidence that it influences people's beliefs and behaviors as well.
Thank you. And we're going to take one last question here. No, go ahead. You've been standing in line the entire. Yeah, please.
Okay. My name is Chidam Chapan. I'm a physics faculty at Washington State University in Tri-Cities. And my question is to follow up on this discussion about how to counter misinformation and what role we all play in this. It's mostly directed to Lisa. Really, my problem is that we only go to the experts in a situation of crisis. But we, as humans in a situation of crisis, we only use our reptile brain, fight or flight. We do not act rationally or think rationally. This is not when we learn, right? We can't learn in that situation. So the best would be, I think, for the news organizations to dedicate some of their airtime or print space to science on a more regular basis outside of crisis. Why only mention climate change and only go to the experts when there is wildfire or flood? Why not do it a year-round commitment in a way that when you cover the scientific topic, you can also have this interview with the scientist and show the human side of that scientist. He's just a human, why he got interested in that field, what's his background, because I think that's how we're going to rebuild the trust we used to have in scientists. That would be my 2 cents.
So I think that we do cover science when it's not only a crisis, although I hear your point that that's when it becomes the top story, above the fold on the front page, right? That's the crises are the ones that go viral. But we do cover science at other times, and there's amazing science podcasts out there. There's a lot of regular science coverage, but there's much less science coverage than there used to be. And I guess I feel like I flubbed the answer on what do you do about like misinformation or like biased news sources. And my answer is to pay for news that you think is good, because that's why conglomerates are. I mean, I get to say that from like the lofty sort of I'm the public, with the public broadcaster kind of position, but that is why they're shrinking newsrooms, right? That is why their reporters are filing to more platforms. That is why we don't have time to look into things, is because as news moves online, advertising dollars are much smaller. Even if people are watching video, they're paying like less per click than you would have on television. So that, like, pay for news you think is good. Pay for science news, support like independent science podcasts if those are the ones you like, or whatever it is. But that's another thing you can do, and we can keep trying to do our best. But humanizing scientists is great, and if you're a scientist and someone says like, tell me a bit about yourself, like be willing, know what you're going to say, but be willing to go there. It does help.
Thank you. As you can see, I have a stack of questions that we didn't get to today because unfortunately we're out of time, but I welcome you to continue the conversation with any of us up here after this and with each other, and enjoy the conference. And if you would help me thank our panelists one last time.
All right. Thank you all for this great discussion. Really quickly, before you all run away, oh, that is not the slide I thought it was. We hope that you will fill out a very short survey for us. We'll get the website up here really quickly, but it's tinyurl.com/CSS20-media, and we'll get that up during the break. But before we break, I'd like to highlight a couple additional opportunities, which you'll see scrolling here during the break as well, to learn about the practice of science communication and to discuss more about science communication and engagement. That includes on Saturday and Sunday, Family Science Days will be at the Sheraton across the street from 11 to 4. So you can see public engagement in action. And then on Saturday evening, join us for a public engagement networking reception at 7 p.m. More information, like I said, will be scrolling during the break. Also, when you come back from break, I would ask that you please help your current fellow attendees who are sitting on the floor and move into the centers of your rows so that we can fit more people into some of these empty seats. And I will see you back here at 11.